He spent 10 years in the army and has recently spoken openly about his own struggles with mental health. Now Prince Harry wants more mental health support for those within the armed forces.
During my time in the army, I saw how important physical conditioning was and how we always warmed up before every run or loaded march to reduce the risk of injury. We should have the same approach to conditioning our mental health too.
Charities say the number of veterans with depression and post-traumatic stress disorder has increased dramatically in the last 5 years, yet many feel unable to talk about it.
We're expected, to man up, and actually that's not a particularly sensible way of doing business.
John White was a Royal Marine captain in Afghanistan when in 2010 he stepped on an improvised explosive device. He lost both his legs and his right arm. But 7 years on, his remarkable resilience is now inspiring others.
Actually, I'm here, I'm alive, got kids, my family still appreciates me being around. You realise that things aren't as bad as they seem.
The MOD has been accused of failing troops with mental health issues in the past, but the government insists things have changed.
We no longer expect people to simply man up. Instead, we offer expert help through Defence Medical Services for our current personnel and through the NHS for veterans, families and civilians.
John says he's coped by never asking why me.
People used to say that to me, don't you ever ask why you? And I was like, absolutely not. And it's a very conscious decision, because by asking why me, you're inevitably wishing it on someone else. And whilst I've been okay with it and managed to survive, I still wouldn't wish it on anyone else.
John says it's not just physical training that's needed, but mental health support too. And putting that at the heart of military life will make all the difference. Layla Hayes, 5 News.